And welcome everyone to another uh, webinar from the Christian Reaganhard Center for Emergency Response Studies. The center is named for Christian Reaganhard, who was a probationary firefighter on 9/11 and was unfortunately was killed that day. He was never actually recovered along with his entire company. And so his mom, Sally Reaganhard, and she's on the call right now. She, along with Charles and I, thought this would be a wonderful legacy for Christian to have a ongoing research center, the Christian Reaganhard Center for Emergency Response Studies, going forward, looking at not just fire stuff, but all sorts of different emergency response, emergency management, and more issues that involve folks in the emergency response field. So we've had, and if you go back in the archives on YouTube, you'll find lectures on all sorts of different things back in the day. So today, we were very fortunate to have Dr. David Daniels, and I'll just give you his quick bio here. Is an occupational safety and health professional and thought leader, the founder and CEO of ID2 Solutions, and host of the Psych Health and Safety USA podcast. He is the author of, and this is the one we're going to focus on today, Psychosocial Hazards Are Real, which is one of the first books to examine psychological health and safety from an occupational health and safety perspective. He holds a bachelor's degree in fire service administration, a master's degree in human resources management, and a Ph.D. in occupational safety and health. He is certified as a safety director, violence prevention specialist, emergency management specialist, and job hazard analysis specialist. He received a certificate in diversity, equity, inclusion from Cornell. That's, by the way, Professor Jennings' own alma mater. I don't know if you knew that or not.
Right?
Attended attended the senior executive and local government program at Harvard and completed the professional practice in psychological health and safety program through Flourish DX Academy in Australia. He's a member of the Society for Total Work Health Board of Directors, a member of the Board of Directors of Safety Rack, and Chief Safety Officer for Workplace Abuse. He is a founding chair of the National Association of Black Compliance and Risk Management Professionals, Safety and Security Industry Work Group. In 2021, he received the National Safety Council's highest honor, Distinguished Service to Safety Award, and that is a big one in our field of more general field of safety, certainly. He served for over more than 30 years in the fire service, including 4 appointments as fire chief in 3 different states. He's a life member of the International Association of Fire Chiefs, and his long commitment to occupational health and safety was one of the reasons he was inducted into the National Fire Heritage Center's Hall of Legends there in Emmitsburg, Maryland. I'll add that in there. Legacies and Leaders. He was the first living African American to receive that honor. So I don't know what more I could say here about Dr. Daniels here, but he certainly checks all the boxes and fills in all the blanks for us. I think we can't find a better expert on the issue of psychology in the workplace here, and I think we'll have a wonderful presentation. So again, just everybody please mute yourself, and Dr. Daniels, it's all on to you now. Thank you.
Well, Glenn, thanks very much for the gracious introduction and for the conversation before we pushed record. I for the next few moments or so just want to discuss a topic that I am certain most folks in the fire rescue service, most folks in emergency response, most folks in higher ed, as a matter of fact, in the United States, most people don't know that much about. And they say once you do a PhD in something, you can legitimately call yourself an expert. So I can legitimately call myself an expert as it relates to psychosocial hazard mitigation. And so let me tell you a little bit about about that topic. First of all, a little bit more on the history. I started with the Seattle Fire Department back in the 80s. As a matter of fact, I was a couple of years out of high school, and I stumbled into a job that changed my life and changed the trajectory of my entire family. It was, I didn't have relatives in the fire service. As a matter of fact, I was doing an interview for my podcast today and was mentioning the fact that the first time I recall as an adult being in a fire station was the day I showed up for recruit school. So I didn't know that much about it at all, other than back in the day, it was a much more stable occupation than the one I was in. I was in construction at the time, and construction in the Northwest at that time, yeah, you work for a while and then then you get laid off and you go back to the union hall and look for another job. And so I just really wasn't interested in that. As a matter of fact, I was working, taking some time off construction and was working in a grocery store. So I got hired. Actually, I had two jobs. I was washing dishes at a Sandpoint Naval Base, and then stacking groceries at a grocery store. And I didn't even have a car at the time, so I'd ride back and ride the bus back and forth to go to work. And so I got a call the day before my 21st birthday from my one of the folks I would put on the Mount Rushmore of the fire rescue service, at least in the Seattle area, Claude Harris, who called me and asked me, did I want to be a Seattle firefighter? I said, yeah. And I didn't even know what that meant. So I ended up going and quitting the two jobs I was on over the weekend. And that was on a Friday. I started recruit school the following Wednesday. What I didn't know is that was a pretty hazardous thing to do, because most people didn't even make it through the training process. I didn't know that. They didn't tell me that, that we had a 40% washout rate in the recruit training process. They didn't tell me that for women and people of color, that rate was closer to 70%. Because had I known that, I might have thought twice about quitting my two stable jobs, even though I didn't like either one of them. But it turned out to be the best decision I ever made. And again, it changed the trajectory of my entire life. They, and similar to folks who have been in the fire rescue service, I'd say in law enforcement probably as well, and in EMS, these industries do an exceptional job of sharing the technical skills that you need to do the job. So, I recall being on my, I'd been on a job for a week, and they tossed us in this concrete room and set a little mattress on fire and this, metal bed, and crawl on in there and you'll see what it's like to be in a fire. And, now, truth of the matter is that was likely in violation of the Occupational Safety and Health Act of 1970. The fact that we didn't have respiratory protection was probably a thing, but that's what we did at the time. We didn't question it. I'm a 21-year-old kid. I don't know the difference. So I go in there and they were teaching us how to keep our wits about us and how to feel the heat in the room increasing. And every week we'd have to stand there for a minute longer. And think about the fourth week, they actually called us out because it was getting way too hot. And our instructor said, get us out of here. It's way too hot in here. So again, they did a great job of training us and providing us the resources to go into buildings on fire, which is a kind of a pretty bizarre thing for human beings to do. But a lot of folks in the US do it. A lot of folks around the world do it. But if you really thought about it, totally objectively, you're taking a human being and putting them into an oven and, expecting them to reduce the temperature of that oven from the inside, which is a really interesting thing. But again, I felt totally prepared. And again, I'll admit it now that I've, retired from the service. I'll admit it was fun. I didn't see it as hazardous or anything like that. I didn't really sometimes even know what I was getting myself into, because of the information it received, because of the support that we got, because of the tools and the equipment and the PPE and all that. I felt totally prepared for it and was looking forward to it. What I wasn't prepared for was the emotional impact of doing all that stuff. They didn't tell me that I would see my first fire. It would take 3 weeks on the job. I see my first person die in front of me. It would take my first third shift on the job. So here I am. I'd never seen a person die in my entire life. I'd been to funerals. Those people are already dead. I'd never witnessed a person's, essence leave their body. And I get tossed into this, and we go to this guy's house on an EMS call, and he's sitting up talking to us. And when we leave, he's dead. And then we go to another call, that same shift. It was within a couple of hours of one another, because the entire day we did virtually nothing. But we go back to another call. And in this case, the person wasn't breathing when I got there. We do CPR for a while, and that person's. So 2 dead people back to back, and no conversation whatsoever about what I just experienced. None. As a matter of fact, the guys I was riding with, they probably didn't think it was a big deal because they'd seen that stuff before. But me, that's a big deal. I go like, whoa, this stuff's real. And it got more real when my colleagues started to die. So I'd been on the job for a year and a half before I responded to an incident. We went to a house fire. I think we were the second due. We get there, we do it back in the kitchen. I remember like it was yesterday. It would have been, the latter part of June in Seattle. It's fairly warm. It's a wonderful place to be in the summer. So we go in there and we put the fire out, and we're picking up hose and all this kind of stuff when it's over. And one of my colleagues from one of the other companies, and I can kind of remember parts of it, stood up and then kind of collapsed. And we all run over there, to see what's going on. They load my colleague in an ambulance and put me on the company to replace the person because I was still fairly new, to ride out the rest of the shift. So my car's back at the others at my base station. They put me on the truck and, I finish out the shift, and come to find out that firefighter never came back to work. It died. And that was the first of 30 experiences over the course of my career of people who died, either, right there in the line of duty or at the incident itself, or died from something they were exposed to, in most cases from cancer. There have been others, and I'm now starting to lose track of some, because what's going on now is many of them are, if they're not dying from the occupational exposures physically, they're starting to have issues from the psychological exposure. So again, I wasn't prepared for the emotional impact of being a firefighter at all, because the organization didn't prepare me, because they weren't prepared either. This is not at all a slap in the face to Seattle or any other fire department at the time, because we just didn't know. We didn't know. We had no idea. We were I was in the first recruit class in the history of the city of Seattle for the fire department that actually was required to wear their self-contained breathing apparatus by policy of the department. And the department had been around for close to 100 years by that time, because that's just not something that we knew at the time. We had a lot of folks that didn't know much about occupational safety. They knew about putting fires out, so they didn't know about the safety stuff. But I consider myself to have been fortunate that I started under a fire chief who said that safety was important, and everybody who came after him was about this safety thing. I found myself involved with organizations inside the best job I've ever really had. The one that was probably the most fun, that I felt the most, that I achieved the most, was being as a shift safety officer in the city of Seattle. I could go to every and anything. Matter of fact, I could self-dispatch myself to anything I wanted to go to. All confirmed fires I went. All the, the mass casualty stuff, the hazmat stuff, all the stuff. I got to go to all of it. And I supervised nobody. That was the other part of it. Was just so wonderful. I didn't have anybody calling me at 6 o'clock in the morning coughing and saying they couldn't come to work. I didn't have to manage any fire stations. But I could, so I got the opportunity while I was a shift safety officer to eat dinner in every fire station in the city. That was one of my goals in my first year, was just to go to every single station and eat dinner there, because I wanted to talk with the people that I was responsible for from a safety perspective. Again, I ended up in that job because somebody else didn't want it. It's not that I really knew what I was doing. I was interested, but I didn't really have any particular skills. So I ended up becoming a safety officer. And as a part of that process, my deputy comes to me and says, "Yeah, well, we really need to have some kind of certification thing." What I didn't know at the time is that the state of Washington had required us to come up with a certification program because of the 4 people who had died some years before that at the Pang warehouse fire. So again, I'm still relatively new at this safety officer thing. So I stumbled across an organization called the Evergreen Safety Council and found out that they had a safety and health specialist program. I still have my certificate that I got in 1999. It is one of my prized possessions professionally, because it was the first certification that I received that was occupational health and safety specific. The reality was I was probably more a safety professional than I was a firefighter most of the time, because to me, people getting injured and killed doing the work didn't make sense to me. Matter of fact, I'm sure I got myself sideways with a lot of folks in the fire service when I suggested that I don't think firefighters should die at work ever. What job do people have when they go, it's okay for people to die doing that work? I do not believe that firefighters, police, I don't think that anybody should die at work. And I also don't believe that there is any job out there that is inherently dangerous. I do believe, though, that jobs and professions are hazardous and that life is a risk management exercise. The question is, how do we manage the hazards that we're going to be exposed to in the work? Now, I'm gonna tie this together, and I have this conversation about, my experience in fire rescue. That's what I talk about in my book. Is I talk about that's where I learned safety was in the fire service. I didn't learn it in manufacturing or construction or transportation or utilities. Although I've done some of that stuff since, I learned it in the fire station, and I learned it in many cases by watching the negative consequence of people not paying attention to the hazards they've been exposed to. I'm not the only person. If you talk to anybody who's been in the fire rescue service for any period of time, they can tell you what happens when people don't wear their seatbelts, when people drive too fast, when people mix chemicals in conditions where they shouldn't, when people, don't mop up the water on the floor, when the guard on the machine is not set properly. They can tell you all the consequences from the people that have been mangled and burned and in many cases killed from not paying attention to the hazards they're being exposed to. But unfortunately, as a society, we don't do a great job of talking about hazards. We talk a lot about risk, but we don't talk a lot about hazards. So risk is the product of exposure to a hazard that you're vulnerable to. So these organizations who talk about risk management, and we have these as a matter of fact, I'm a part of an organization called the National Association of Black Compliance and Risk Management Professionals. And many of these folks are in our financial industry. Did you know, you may not, that as a country, we have many, 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 many more systems to protect our money than we do to protect our human beings. The Securities and Exchange Commission has about, last I checked, I'm not sure because they've laid some people off these days, but at least a year or so ago, there were about 4,500 people or so in the Securities and Exchange Commission. And there are lots and lots of rules and regulations about how we manage money and how banks, exchange our money and the systems to protect our financial assets and resources. There were only 1,800 people at OSHA. And some of those are technically not at OSHA. They're actually in the states that have the 27 states that have state plans. So if across the entire country, less than 2,000 people specifically in place to monitor the occupational health and safety of human beings. As a matter of fact, we were a country for nearly 200 years before we decided we needed a federal law to protect the health and safety of workers. That's kind of interesting to me. That's interesting that we place way, 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 way more emphasis on how we protect money than how we protect people. And I argue that if you take care of people, you're going to save a lot of money because injuries cost money. Fatalities cost money. It said the National Safety Council will tell you that anytime a person is injured, and if they're the injury is probably going to cost you about $40,000. If you kill the person, it's probably going to cost about $1.3 million. And that's those are estimates based on all kinds of things. But injuries and fatalities cost money. And that's the same money it costs in the private sector. It costs the public sector. So many of our local governments, we have close to 90,000 governments in the United States. Many of them are involved in the things that don't make money, like fire services, like law enforcement, like EMS, emergency medical service delivery, like disaster response. These things don't make money, but they are essential. They are essential to having a reasonably healthy society. And these local governments take these things on, and often the big cost is the human beings. That's what costs the money. Organizations cannot afford to go through the process of selecting highly qualified, highly trained people, investing a bunch of money in their development and getting them all this equipment, and then have them getting injured and killed. So an organization that operates 24 hours a day that injures a worker is going to pay 3 to 4 times the cost of that worker, their 3 to 4 times their salary to actually get their work done. It costs you more when people are injured than it does when they're healthy. Not only is that cost associated with their physical injuries, but it's associated with their psychological injuries. There is a thing called psychological injury. And the harm that people are exposed to psychologically, that harm is again associated. Harm comes from risk, from exposure to hazards that you're vulnerable to. And so that's where my research is around this concept of psychosocial hazards. I didn't know much about psychosocial hazards until I, well, honestly was in the process of writing my dissertation. My my research is qualitative in nature. I don't really like numbers. I'm convinced that much of our quantitative research. So I did qualitative, but most of our quantitative research is it doesn't really change people's minds if they don't want to change them already. And that's what we've got this entire system to give people more numbers and more data and more numbers and more data and more, more trend curves, when I really don't want to do that. Dr. Myron Golden suggests that people do things for one reason and one reason only, because they feel like it. And if they don't feel like it, you can give them all the data in the world and they're not going to change the way that they behave because they just don't feel it. And it is my belief that we don't spend enough time trying to influence and pay attention to how people feel. That's even in our conversations about safety. Most conversations about safety are relative to our physical safety. Again, when the OSH Act was written and passed by the 91st Congress, most of it, if you were to review the 19,600 or so words in the act, you're not going to find psychosocial mentioned at all. You're going to find psychological mentioned twice, and that really has to do with the work that goes on at NIOSH. So that act in and of itself was not written to address how people feel emotionally. It was written to address physical, safety, ergonomic, biological, and chemical hazards. Because as a society, particularly in the US, we've done a pretty decent job of addressing those hazards. We've done a pretty decent job of creating a respiratory standard, and we do, in terms of how we, deal with chemicals. We're much better at that than we are dealing with how people feel. But I'm here to suggest to you that psychosocial hazards are often what's behind the physical manifestation of harm that we deal with in the workplace and even in society. So what is a psychosocial hazard? According to my research, this other thing I'll say because it pops to mind, there is an international standard. ISO 45003 is a guidance document. It's associated with ISO 45001, which is the international standard relative to occupational health and safety across industry. And so 45003 addresses psychological health and safety. So the conversation about psychological health and safety is new here in the US, but there are actually 40 countries, last count, about 40 countries across the globe who see psychological and physical safety as the same thing. You have the same responsibility. I was on a webinar just yesterday. Matter of fact, last night, it would have been noon in Australia, but it was 9:00 my time, where they were talking about a set of standards that were just released in Victoria, Australia. They were the last of the areas across the country that to release their standards relative to psychological health and safety and psychosocial safety, which is the concept that is really big in Australia. It's also big in Canada and the UK. Those are the three leaders in this area. And part of the reason that I wrote my book was to try to convince us here in the US that it's something we ought to pay attention to. But in that international standard I talked about earlier, it lists 88 psychosocial hazards It defines psychosocial risk, but doesn't define a psychosocial hazard. And I thought, well, I don't know, there was an oversight. I know a couple of people on the committee. They said it was more important at the time to give the examples. And I think they're going through a review and will probably go into more detail about the definition. But I thought, I really want to define what the hazard is, because when I see a list of things, who says that that's a hazard? Who decided that that should be on the list? So the definition from my research is a psychosocial hazard is a psychosocial factor that's perceived or experienced as threatening to the person exposed to it, and it also causes their behavior to change. Perception and experience are important when we talk about psychosocial hazards, because it's not like a chemical. A chemical, and as a matter, the reality is, most chemicals in and of themselves are not inherently dangerous. It is how that chemical is used, what condition, what that chemical is in proximity to. So, triethyl chloride, as long as you leave it in the proper container and don't drink it, is probably going to be okay. But again, as I learned as a hazmat responder, it's when these chemicals are put in positions and places where they weren't intended to be that they cause hazards, where humans should not be exposed to those in the quantities that they're exposed to them. That's when the risk pops up. But with a psychosocial hazard, it's not the chemical property of the thing. It is the perception or experience of the person exposed to it. And so the international standard breaks this down into 3 areas where you can be exposed to a psychosocial hazard: the work itself, how the work is designed, and the people that you do the work with. So let's take that back to the fire rescue service. Fire, heat, fuel, oxygen, and the chemical reaction in and of themselves is a naturally occurring phenomenon. You put those 3 things together, you get a fire. And there's some good things about fire. We need it to, warm our food and to keep our buildings at a comfortable temperature. So fire in and of itself is not inherently dangerous as long as it's used in a set of parameters. But when you get too close to it, when you breathe in the off-gassing of the material that's been decomposing or that's been breaking down because of the exposure to the heat and all that type of thing, there's some issues about it that can create harm to human beings. And thankfully we have lots of industries and lots of folks who pay attention to that, fire rescue service being part of that. So the work itself is not dangerous. It is a hazard that has to be managed. And that's the way I think about, going to fire. There's a way to make sure I don't get burned. It's to not go in. And there were times when I show up at an incident and we're not going in there because the extent of involvement and the likelihood of, saving another human being is virtually, the involvement is everywhere. The survival profile is 0. So why put 4 more people at risk because we're not going to save anything? So again, the work itself is one of but those are the physical aspects, but there is a perception. Should I go in or not? Well, so one of the things we used to do is we get up on the front porch and there's lots of noise and all that, but it's looking around and everybody got to give the thumbs up before we go in. It doesn't matter. If one person goes thumbs down, we don't go in because they may have seen something I didn't see. So it doesn't matter. There's no second guessing that. And I can recall before we started to have conversation about those kinds of issues, there were some things I really wasn't really comfortable with, but I kind of did it anyway. The first fire I ever went to, I'd been on the job for 3 weeks. We show up at a fire in an apartment building. My officer and the driver get off the truck and vanish, and they leave me standing on the tailboard by myself. So I put my steel, survive air, self-contained breathing apparatus on, and I walk in this fire by myself. I've been on the job for 3 weeks. I'm 21 years old. I have no idea really what I'm supposed to do, but I know I shouldn't be standing out there by myself. So I'm wandering around. Nobody asked me where my partner was. Nobody asked me what I was doing. I had a big number that said I was a recruit. Nobody asked me anything. I just wandered around. And then I walked out, and when it was all over, we all got on the truck and left, and nobody talked about it. But that felt weird to me. That felt strange. It happened more than once where my officer would just leave me. But again, that was the generation that he was brought up in, that accountability thing. And until we, lost a number of firefighters getting separated from their partners and all that type of thing. We didn't pay any attention to it. And again, I say this not as a criticism, but as an observation. That's where we were at the time. But psychologically, something's going on. So I got to the point to where if my officer wanted me around or not, wherever they went, I went. July 12th, 1987, we showed up at a fire in an apartment building, a lot of fires in residential dwellings. That's where most fires occur. And the upper part of this building was vacant. Why we're in there in the first place? Why? Because we're firefighters. We go in there anyway. There's nobody living there. There's a convenience store on the first floor. And there were 5 of us on my company at that time. And the one guy sitting to the left of me was from the other shift. And he was a driver on one of the other shifts. He was a driver on the A shift. This was the B shift. So he could have driven that day. He decided not to. That decision, I submit, ultimately cost him his life because riding backwards with me, he hopped off the truck and vanished. And I didn't even think that much of it because that's what the senior people did. I was following wherever my officer went, that's where I went. I've done a job for 6 or so years at the time. Wherever the officer went, I went because I didn't want to be by myself someplace. We've been there for about an hour and noticed that he was missing, maybe a little bit less than that, but we noticed he was missing. We walked up to the deputy in charge and told him, and he says, "Oh yeah, he'll probably, he didn't seem really concerned about that either." When we went back the second time, he finally, we could see some urgency, and he started this, search to find our missing colleague. And we went to sit down across the street because we were exhausted at the time. And we barely sat down when I heard over the radio that they found a firefighter down on the 3rd floor of this building. That was my colleague. And I still remember like it was yesterday, them carrying his lifeless body out of this building that we probably had no business being in the first place. That building has now been torn down. There's a totally new building there. His life was lost. And if you weren't there, most people have no idea that happened. I don't think it was worth it, to be honest. I don't. And the emotional, I went back to the fire station, and my now wife, we were dating at the time, came, and I thought real serious about quitting that day not because of the fire, but because of seeing one of my colleagues get killed. That just really bothered me. And so again, the work itself, there are some psychological issues associated with my perception of that same. Some people, that wasn't a big deal to them. To me, it was. So the work is one of the areas where we can be exposed to psychosocial hazards. The other is how it's arranged. Who says we should all be working the same schedules? The Fair Labor Standards Act that suggests that people should be paid overtime if they work more than 40 hours is based on the conditions in the country in 1938. 1938. Really? Seriously? We have many, many, many fire departments across this country that are working, 48 hours, 52 hours, 56 hours, 72 hours in some of the federal organizations. Why? Well, because that's the way we do it. Why? That's the way we do it. I mean, should we really be exposing people to that level of risk over that period of time? Again, I'm here to suggest maybe not. I'm not saying this is the more birthdays I have, the less interested I am in binary choices. So I believe that we ought to be doing more research on, frankly, I think fighters ought to be on a pitch count. That after they've been exposed to a certain amount of risk, then we should move them to some place that's going to expose them to less risk. That, this idea about, how many calls can they go on is harming them emotionally and physically. I believe that. And again, there are some folks who will argue me to the death about got to stay on this shift. And okay, yeah, you like it when you're 25 or 26, but you're going to look back when you're in your 40s or 50s and you're going to go, maybe I was exposed to a little bit too much, And again, I'm not here to, to suggest that there are bad people making these decisions. I think people are making the decisions they believe that make sense at the time. But how work is arranged is a psychosocial hazard in and of itself. And the last, and we're, I've been yammering on for a while. I haven't seen any questions quite yet, but please, if you have some, please toss them in the chat. Psychosocial hazards, the area where you're going to be exposed the most is social interactions. It's the people that you work with. So the people that I work with, some of them were really cool to be around. Some of them weren't. Some of the people that I provided service with were just great to be around. Some of them weren't. And I'm not here to suggest that they're good or bad people, because that's not the point. I don't know what was going on before they called me. I don't have any idea. I know that they called, but I've been to calls where people wouldn't let us in, and people would, I've been to calls where people would try to take a swing at us. Sometimes because, we gave them some Narcan and they were coming up off that high and they just started swinging. So I'm not here to place blame, but that was a hazard to me because of my interaction with that person. And I've had people call me all kinds of things. I believe that much of the psychosocial risk and harm that I might have been exposed to was mitigated by the fact that I got promoted early. And I was, the fire service being a paramilitary organization, there are some things that they probably wanted to say to me, but I was a lieutenant or a captain or a battalion chief, and they wouldn't, because, not because they cared that much about me, but they cared about the stuff on my collar. So that probably shielded me from some things, but it couldn't shield me from everything. I had, I'll say this now and I'll wrap. I was one of the members of Washington Task Force 1, the Urban Search and Rescue Task Force that responded to the Oklahoma City bombing. It was one of the first times as an adult that I traveled to the Deep South. And there are some things about living in Seattle, again, that shielded me from some of the history of the country. I got shielded from that. I didn't realize until I was writing my book that I attended technically segregated schools in Seattle until I graduated high school. But I didn't know that because that's not something that we necessarily talked about. But anyway, so I go to Oklahoma City, and I was there for 8 days. And I recall towards the end of the deployment going into the restroom and seeing the N-word written on the stall that I was in. And because I was the only Black member of the task force, there may have been two of us, but I very few. And I'm here in the South, and I'm in this convention center. Who do I go tell that I've seen this? I mean, who's going to really understand how that felt to me? So I really didn't say anything about it. I just dealt with it. But that was a little traumatic for me because that's not something that I had been exposed to over most of my life. And again, I didn't, there really wasn't the system. I didn't feel of people I could go to and, say, hey, help, look what I've just seen. And people have their issues about, race and gender and difference anyway, but that was my experience at the time. And it was just one of the situations where I had to be exposed to something that made me feel bad, and I just had to deal with it. As I've, transitioned more into occupational health and safety, that's been my cause. It's sometimes I feel like it's my mission in life is to get people in the United States to see that so being safe and feeling safe are two very different things. And you can have all of these systems. We've got our safety management system. We've got PPE. We've got, all these policies. We've got strategy and tactics and all this stuff. But if people don't feel safe, I'm not sure how effective all of those efforts actually are. Safety doesn't work real well when you try to do safety to people. This is just do this thing for being forced to do a bunch of things that we say is in the name of safety. Safety also doesn't work very well when you try to do safety for people either. It disempowers them. We have to do all these things so people can't make decisions, and you end up with these kind of micromanaged or super uber controlled situations that don't give people the opportunity to be themselves. Safety works best when we do it with people. That safety is about a conversation between you and me, not just you, but me, you and me. I need to know that day that I'm not feeling at my best, I can come to my supervisor, my colleague, and say, I'm not really at my best today. Something's going on with me. Or, to be able to have you come to me and say that, yeah, I'm just not feeling it today. And that we reverence that we respond to that. It is that mindset that is driving what's going on in Australia. In Australia, over the last, and this is at least the data I've heard, that there's been a significant increase in the number of workers' comp claims that are mental health related. Because, yeah, you can go on workers' comp in Australia and a lot of other places around the world because of the stress of the work, because of what I experienced at work. And often what we get here is go out and just do more of it. I believe that as we pay attention to how people are feeling, when that thing comes up that causes them to feel different, if we paid attention to that, that we could avoid some of the physical hazards that cost us, and in some cases are costing people their lives. So I could talk more. I could talk about this for a really long period of time, but I assume that people do have things going on in their lives and they may not want to spend all their time with me today. So again, I wrote this book called Psychosocial Hazards Are Real.
Would you hold it up to the camera there for a sec?
I will. I got one back there. Here's one.
There we go. Okay,
there we go.
Okay.
Yeah,
we could see it.
Yeah, and actually, the book is available. It's available on my website, ID2 Solutions. It's available on Amazon and other platforms if folks are interested. And the book is really written. It's kind of got three stories, or it's three books in one, or maybe two and a half. The first part is really biographical in nature. I try to talk a little bit about, how I came to feel the way I feel about safety in general, because my thoughts about psychosocial hazards are based on my thoughts about physical hazards, because that's what I learned first. This conversation about psychological health and safety is rooted in my understanding about psychosocial hazards. And it is, they're a real thing. And the issue for many organizations is that people don't think it's a thing. They don't think it's a thing, so they don't do anything about it. There are many organizations out there. If you were to look at their OSHA, logs, you'll find not a single recordable injury over X number of years. But what if we track what was going on with people emotionally? People don't leave your organization because they like it, because they really enjoy it and feel great. They leave because they don't feel good there. They don't feel safe there. And often they're leaving the person or the people that don't make them feel comfortable there. So if you really want to, that's the first part, is my biographical kind of, a little bit about my life and experience myself. Then I talk a little bit about, I use the international standard. It's actually the framework that the book is built around. I talk about all 88 psychosocial hazards. I go into way more detail than the standard does, because the standard isn't intended to go into that level. So I talk about each and every one of those in some detail about, so what is that? What is role ambiguity? How can that possibly be a hazard? So I talk about it. And then that's the second part. That's chapter 10 through 13 or so. And the last few chapters are intended to be kind of hopeful, that I don't try to solve it for people, because I can't. I mean, we can have some conversation. I'm happy to work with people, but there is no cookie cutter approach to addressing psychosocial hazards, because the existence of the hazard itself was in the mind of the person who experienced it. So it wasn't a hazard to you, it was to me. And it doesn't mean it's such a big deal that we're going to have to stop everything, but I need to get that addressed for me. And sometimes that means just somebody listening to my concern. Sometimes that means that, maybe I need to be able to come in a little bit on a different schedule for the next few months because I'm dealing with a sick parent or a sick child, or maybe that means that, I need to have a different kind of tool because this tool doesn't work because, it was designed for this kind of person, but it doesn't work well for me. It's expanding this idea about what a psychologically healthy and safe environment looks like, and doing what we can to make it safe for as many people as possible. I will say this is not about being nice to people. It's about recognizing that people have the potential to be exposed to harm. You're not going to get everything you want. Not everybody can do everything. There is no such thing as a hazard-free environment. It doesn't exist. Hazards exist everywhere. How do we manage them? How do we mitigate them? How do we use that hierarchy of controls to address the hazards that exist in our environment? How do we deal with it? That's all. And sometimes that means it's not going to be a right place for that particular person. And that's okay. But even how we do that can be done in a kinder, gentler, safer way than treating people like they're disposable, pieces of trash and tossing them out. So again, that's that's a part of the story. So let's chat. So let's see if there are any questions.
Yeah. So Charles actually posted the your book, a link to your book. So it's in
Okay.
the chat box. And I'll start off, and then he's got a question. So I guess at least within the fire service, you perhaps you agree with this. You and I are probably about the same vintage, and so you discussed earlier about this. You were the first class in Seattle to actually adopt use of SCBA when 98% of the guys in Seattle Fire Department didn't use
No,
it, and I would
no,
say a chunk of them probably didn't look favorably on it because if it was felt that it was some kind of crutch or something that you should never use, right? And so
right,
that took some time to sort of evolve, and nobody would ever today, David, never no one would ever think about using SCBA for the most part,
for the most
right?
part.
We've come a long way with that, but the analogy for me is that you know, thinking about how when you talk about psychosocial issues going on in the fire service, how we've treated suicides within the emergency response community, and that's been I would say a more recent thing. Maybe in the last 10 or 15 years, we've taken a
Right,
much harder look at what is going on here. And various support networks are coming forward and things. Again, you and I both know people that aren't even around anymore that we
that's right,
perhaps knew or
that's right,
worked with, that didn't think twice about these really horrific situations that occurred over the years, and it was certainly taboo, to basically ask for help, right, or to think
right,
that there's some
right,
kind of
right.
something going on up here as opposed to
That's
something
right.
going on with your hands, right? So
That's exactly right.
so I think historically we're still in that evolving stage, I think, for at least for suicide, because it's still to some extent, that it is just some commentary about what you were saying here. Charles asked, can you discuss psychological safety that may be implicated in situations that may be implicated in issues of situational awareness and information sharing? So
Yes,
thinking
yes,
about being in an
yes.
environment, what is actually, do I understand what's going on here? Or is there something else
Right,
going on
right,
that I don't
right,
understand, right?
right, right,
And sharing of information. So he wants to
right.
talk about that specifically.
So let me so a couple of things. One is firefighter suicides are 2 to 3 times higher than the general population and 24% higher than the average worker. So the likelihood of a firefighter dying by suicide is much higher than virtually every other average human being. Now, what I will say is I haven't found an industry yet where the leading cause of death is not suicide. Now that we started paying attention to it. In construction, you're 4 times more likely to die by suicide than all the other causes. Oil and gas, I mean, you name it. So it's not just the fire rescue service. We're having this awakening that, but again, it indicates to me the importance of the psychological piece because not all these folks had a broken leg or a broken back or anything. It was something that was going on emotional. So psychological safety or the Edmondson concept. Dr. Amy Edmondson is given most of the credit for this concept. It's been around for a lot of years, but the psychological safety is it's a team thing. It's do we in the team feel that it's safe to have a different opinion, to express what I'm seeing and not have to worry about the retribution that goes on for me being different. I did not come up in a psychologically safe environment in the fire rescue service. I didn't because that's not what it was. This is the way it is. You will do it this way because those are the rules. But I do have there's a story I was told about the Pang warehouse fire, January 5th, 1995. One of the companies is getting ready to make entry. So there's 4 firefighters total, a lieutenant, a firefighter, and then 2 other firefighters in 2 different teams. They're getting ready to go in. So the lieutenant and the firefighter go in. The second team, as they're getting ready to go in, they notice smoke coming up between the sidewalk, the sidewalk and the poured concrete floor. And I heard this from the person who saw it. He says, I noticed that, but I didn't tell my lieutenant because he wasn't the kind of guy who was going to listen anyway. He was of that generation who said leadership means that you know everything, you tell people what to do. You particularly in a fire, you're the theory X, you gruff, because that's how he was trained. So they go into this building, and within a really short period of time, the floor collapses. The two people up front are dead. The two people who saw the smoke survived, and now have the survivor guilt about, what if I had brought that up? Maybe that might have changed something. It may not have. So this is an example that we have people every single day that are on fire calls, EMS calls, hazmat calls, at disasters, who see things that the leader doesn't see, but won't bring it up because the leader has not created the environment, has not fostered the environment where people want to speak up. I'm the lieutenant, I'm the captain, I'm the chief, I'm whatever, and nobody has anything to say other than me. And that's a thing. That's an issue. That's an issue that is causing people to place themselves at greater risk, and to place you at greater risk as a leader. So psychological safety gets built by all of us, not just by you. We all have to contribute. It's this kind of co-design idea that says we both have to contribute. Again, safety works better with me, not to me, not for me, but with me. And so I might see a psychosocial hazard that you do not see. I may be sensitive to it and you may not. Me bringing it up gives us both the opportunity to address the hazard in front of us. So that's how all this stuff is connected. That's how I can argue that major global disasters, the Challenger, the Columbia, the 3 Mile Island, Chernobyl, psychosocial hazards existed that were, there's a guy who was in the control room at Chernobyl that thought this whole thing we're doing is kind of weird. What are we doing this for? But couldn't speak up because of the environment. There was an engineer who thought that worked for Morton Thiokol that thought, man, that deal with those O-rings, I'm not sure if I got some issues with that. But the company and NASA, between the two of them, we got to launch. See what I mean? So there were psychosocial indicators of hazards or risk or harm that were simply not paid attention to, and ultimately people died. And in the case of Chernobyl, people, across the globe were affected by cancer that could have been eliminated by a system that paid attention to one person who says, this doesn't seem right. So again, I'm convinced that we can eliminate lots of small things and lots of really huge things by paying attention to how people feel.
Right. I think, and that's, you're right that, this is all evolutionary how things happen. But even in New York, I would say, for several years now, they've been much more proactive when it comes to having perhaps the lowest level, the basic firefighter at the bottom of the pyramid still have a role there, in terms of what Charles
Right.
mentioned with situational awareness and
Right.
having the ability to communicate hazards, as you pointed out in the Mary Pang fire, that we can't run fires the way they were run for years, where the only person who was the all-knowing chief and that was it, right? That we
That's right.
really
That's
should
right. That's
have.
right.
We should really use the eyes and ears of everybody there. And that's, of course, the bottom line is that the firefighters are where it's happening, right?
That's exactly
They
right.
can see
Yeah,
things, and
that's right.
it's not even decision making. It's more about information gathering and
That's
communicating it, right? And
that's right.
sending it over. So I guess, again, there's slow progress, in these things. But it
Well,
is, yeah, go ahead.
yeah. Yeah, what I was going to say, I think there's slow progress, but I think the progress is still focused on changing the people and not necessarily changing the environment. So I'm on the board of directors of an organization called the Society for Total Worker Health. And total worker health is a concept that was actually conceived in NIOSH, and they have, in essence, passed that concept to us in the society. One of the things that the society has is this hierarchy of controls for total worker health. In the United States, it is the best model that we have to be able to address psychosocial hazards, because it starts with eliminate, but it looks at issues like perhaps redesigning the work. So if you can't eliminate the hazard or substitute it for something that's less hazardous, maybe we should just redesign this process. Maybe, and you name it, there are lots and lots of things that are going on from a psychosocial and physical perspective. Why do we keep doing it that way? Because what I hear is about the tradition. Tradition is paying homage often to dead people. Why don't we ask the live people about what they're exposed to? Why don't we ask the current people in the organization about what their issues are, as opposed to, well, we did this way 40 years ago. The environment 40 years ago was different. It wasn't better or worse. It was very different. We have a generation of people, and I know, some of my, baby boomer colleagues, they bristle when I say this. I want to believe I probably was a Gen Zer that was born 37 years early, because I agree with them. I'm not really into going into places that, that don't respect me, don't want to treat me some kind of, I don't have to be there. I don't want, and that's what they're doing. So they look at your application. They look at the 17, interviews you have to get hired. They can go online and get a job sometimes by clicking a few things and have a virtual interview. And again, I'm not naive enough to believe that some of these processes aren't still needed, but are all of them? Do we really have to traumatize people? Do we really have to treat people and, to scream and yell and treat people? They're not going to take it. They're not going to do it. They're not. And so, and the people that we lose in those processes are the ones that have the most options. I can go do something else. I had a kid who was in one of my recruit classes when I was a chief of training. He came out of high school. He took the test when he was in high school. He passed, came into the recruit academy the fall after he after he graduated high school, made it through. Although at the end of the class, some of the instructors came up and says, he shouldn't finish. Well, why? Well, he's too young. Go like, no. Luckily, I was a chief of training at the time, because that's ridiculous. He passed. Yeah, but he's too young. So what? He's 19. He knows how to do this. So, but that belief followed him for his 5 or 6 or 7 years in the fire rescue service. Well, he eventually decided, okay, well, I can go do something else. He went to Cornell University Medical School, and he's now a physician. So you ran off a really good kid who's not orthopedic surgeon, doing well for himself, but it's a shame that we're running off people because of these dated ideas about how old people are and how tall they are and all this other kind of nonsense. Can they do the work? Yes. Can they perform, in pressure situations? Yes, they can do it. They just do it different from you. So why aren't we changing the systems around people? Why are we still trying to change people themselves?
Right, exactly. Paul Maniscalco commented about our old FCBA days when that was the pre-positive pressure, the old demand mask, right? So that was a whole thing with that, with our mask hoses and things, putting in our coats and things. But he has a specific question here. Can you speak to the issue of cumulative exposure trauma, especially in EMS personnel? We're seeing a trend that is emerging, that those who have survived long enough to job to get to retirement finish line, those actually can get to retirement, are experiencing psychosocial issues resulting from the constant exposure. But systems are telling them, of course, to suck it up and get back in service again. So
Yeah,
I think we could perhaps argue that EMS is even more of a victim of these kind of issues, perhaps even more than firefighters, actually.
it is the frequency of the exposure. So vulnerability is about frequency, severity, and duration of exposure to the hazard itself. People can go on one of these or two of these. They can't go on 40 of these and not expect there to be some type of impact. And again, unfortunately, we have systems, not just the people leading, but the system that says, oh, they have to go on so many calls. Why? Somebody created that idea. Why is it that they have to sit on a corner and can't have a break? Why is it? Why is it that we can't rotate them to another route that doesn't have as many calls? We know where the calls are. We know the kind of things they're going to be exposed to. We know that. So why is it that we put people through it over and over and over and over and over again? So my my stepdad went to Vietnam when he was a teenager. I think he was 17, and he is now getting close to 80 and is still dealing with the exposure of going to Vietnam. Still dealing with it. Still dealing with it. What do we expect people, human beings, to do when they are exposed to stabbings and shootings and dead babies and over and over, over and over and over and over? Why would we be surprised if they are not having issues later? Human beings cannot take over and repeated exposure to this kind of trauma and expect there's not going to be. And on top of that, they're underpaid. Their benefits suck sometimes. They're riding around in a vehicle that will barely start. I mean, this is horrible. This is horrible. And as a society, we all have to do a better job and consider, how does this cause that person to feel when we do it this way?
Right.
And there are impacts to that, and those impacts are sometimes felt years later, and we're going to have to clean that mess up at some time. And I'd rather not have the mess in the first place.
Right. No, you're absolutely right. You're absolutely right, because it's sort of the forgotten about. I mean, we think, again, just from my perspective, you think about health and safety. It's about not getting hit on the highway. It's not falling through a floor. It's not all those kind of things, which are obviously very important in terms of
They are. They are.
firefighting or an EMS, all the issues of physical injury, of back injuries, all those kind of things. So, we think about that a lot, but we don't really, as you point out, we don't spend anywhere near enough time to think about what are the psychosocial impact that we're having on the workers that day in and day out are dealing with these issues and stuff. So, David, yeah,
I just want to say this before we close. I'm gonna suggest that even the physical injuries, many of them have psychosocial roots that we didn't pay attention to. The person ran into the back of that vehicle. They ran to the back of that vehicle because they were overstressed, because they'd been on too many calls, because, you see what I mean? So I think we can avoid some of the physical hazards by paying attention to the psychosocial ones.
Right, right. And Joy pointed out that the best captains of all of dealing with, again, paramilitary type organizations or military organizations always rely very heavily on the folks below them, right, to inform them and things. And then the final comment from Paul here says, "Thank you, David. This was the best 60 minutes he's invested in a seminar in a long time. Rock on,
Right.
brother, and keep up the good fight for all of us." So I think that's a wonderful
My pleasure.
exclamation
Thank you.
point to your presentation here. So
Absolutely. Absolutely. Thank you. Thank
and
you very much.
yeah, no, it's very, very important. And all of them, like I said, everybody's commenting how wonderful it was, and we do appreciate it. Now, I have a homework assignment for you, David.
Okay.
You you need to put something together for me, that an article for me that I can put in fire engineering. Okay,
Okay.
about what we just talked about today. I mean, there are some other folks in the field that they're talking about these kind of issues and stuff, but I think you've really hit really hard on a lot of these things, and particularly, with the book that you've, of course, written, focused on this. This is something that we keep, we got to get it out to the leadership in our organizations. Hey, look, we have to pay attention. Listen, as you know, the public is not thinking about this, right? I mean, if we tell them, they're not going to be happy with about it. They're going to say, "Oh my God, I didn't realize this." But ultimately, it's our leadership that really has to be the ones to initiate some kind of more positive change, or sorry about my phone, more positive, advocacy for what you're talking about, being proactive and actually doing these things. And so that's your assignment from me, actually. So
Right on. Right on. Right
no
on.
due
Right
date
on.
on it, though. Whenever you get it done, I'd like to,
Okay.
more publicly, put this out for more, more general fire audience, basically. So,
Absolutely.
so
I'll take you up on that. Yeah.
okay. And Charles said, "Thank you very much, David." So Charles was actually, I have to thank Charles because he's the one who initially set this whole
Absolutely.
webinar up for today.
Yeah.
So
Yeah.
So he's Cornell. That's the other thing too. So
Yeah, absolutely,
we just come up
absolutely.
3 or 4 times today.
That's right.
So
That's right.
there must be something magical about that. So and so Joyce says thank you as well. So I guess that's pretty much it, David. Again, we appreciate you taking the time to come on with us. And again, I'll chop off the beginning and chop off the end here. Not your homework assignment. I'll have the base presentation
Sure,
available at some point. Charles and I have to work on that together to get it up on YouTube, so
sure,
other people
sure.
can access it and be some more followers for you. So
Absolutely. Well, yeah, Glenn, and thanks very much for the invitation, and Charles for reaching out to me. I still have a soft spot in my heart for my brothers and sisters in the fire rescue service. Again, I've always been and will always be a safety guy, but I know where my foundations are, and they're with the brothers and sisters on the BRT. So yeah,
there you go. That's a great point to end on. So thank you
absolutely.
so much, Dr. David Daniels.